Well, Bill, right now the commissioner is clashing with members of the Board of Health who are responsible for advising the commissioner on public health policy. Now, today, Dr. Greene is reaffirming some of his views while walking back others. And even after a lengthy discussion, some board members say they're still upset.
Your words were very hurtful. Your words were very damaging.
The leader of Virginia's public health system, Dr. Greene, goes before the governing body that holds him accountable, answering questions about controversial comments he made about racism in public health.
I am certainly not satisfied with all of his answers.
The commissioner of the state health department came under fire last week after the Washington Post reported he downplayed racial disparities in health and rejected racism as a public health crisis.
Racism is a public health crisis.
During a public meeting Thursday, members of the Board of Health emphasized their disapproval of Greene's remarks, which he now reverses.
Allow me to reassure you that I am not so naive as to hold such a foolish notion.
The board also asked Greene to address a quote in the article in which he said racism is a politically charged word.
Okay, I don't have the quote in front of me. And unfortunately, well, that's okay, because the other thing I don't remember, of course, is the context in which the discussion took place.
May I just say one thing? Those are strong words that you use, so it's hard for me to understand that you wouldn't remember the context of that when you're discussing something that you know to be as politically charged as discussing racism.
A board member then read the quote to Greene directly from the paper.
If you say racism, you're blaming white people, Greene said.
Greene says what he meant is that he prefers to focus on specific effects of racism in health and not the broader language.
What I want to do, and this is just one of many topics, is to avoid using language from the outset that's going to alienate a large chunk of the audience. I want to avoid being divisive.
Though the board disagrees, Greene reaffirmed he believes the term gun violence is off-putting to some Virginians.
Denying the term gun violence is every bit as bad.
And that structural racism cannot be objectively measured.
And in fact, we can measure structural racism and discrimination.
Greene says he invites differences of opinion, but the board chair says she hears otherwise from state health employees.
Folks in your agency have reached out to us and said that they do not often feel safe in expressing differences in opinion.
All 15 members voted to approve a resolution stating the commissioner embarrassed the board and should not deny, quote, basic scientific facts like racial disparities going forward.
I'm disappointed in this commissioner, and I would love to see somebody else, but I don't expect that that's likely to happen.
I intended to ask Greene if he had a message for those offended by his comments. I was just wondering if you had a moment to answer any questions or
comments I'm going to make today are the ones in the meeting.
Okay.
Yeah.
Did you have maybe just like a general message just for Virginians as a whole?
Just what I said.
Just in the meeting? Okay. All right. Thank you. And when Dr. Greene was asked how he would better communicate the mission of the Virginia Department of Health moving forward, he responded he continues to learn. A reminder that Governor Youngkin appointed Greene to his position, and he's the only one who can remove him. At this point, the governor says he hasn't made a decision yet about that.